we've got something much better. We have Dr. K. That's right, Dr. K, ladies and gentlemen, Dr. Kevin Kavanagh. He's retired ENT and also founder of an organization called Health Watch USA, and he's the real deal. Hey, good morning.
Good morning, sir.
How are you today?
Very good. Up and at 'em.
Good. White House Pandemic Advisor Dr. Birx, now says that there may come a time when we have to wear face masks even in our own homes. Was she just pulling our leg because the president called her, what did he call her?
Pathetic, I think.
Yeah, called her pathetic. So I wondered if she was just getting back at him, or do you think there's some validity to that statement?
Well, I think there's some validity. That is if you have people who are at high risk for COVID-19 or elderly in your home, or if you're working at a job that's not something where you can really protect yourself all the time.
That makes sense.
Yeah, so I've heard that before, and I think that's good advice. It's better to be safe than sorry. This virus can be quite deadly in a certain group of people, and in other people, as you know, you can develop chronic problems from it, which can be disabling. So we want to respect it, and right now, let's follow public health advice.
All right, the note that you send me, you keep me well prepared here. You say there's not much new that's happened except some good news. Let's hear about some good news.
Yeah, I think there's some good news. When I look at the 7-day average for the nation, you see that the new cases they're starting to drop, and they've been dropping steadily now for over a week. So I think this week, as far as bad news goes on the TV, is going to be the worst, because as you know, deaths trail. They're a lagging indicator from cases. And then after that, hopefully things will tend to die down. The real danger is that if they do go down, let's not think the virus has gone away, because it's still out there. If we go back out and we start partying, we start living the way that we used to live and what we consider as normal, that virus will come raging back. So we do need to follow public health advice, and that's very good. And the other thing I think is something to remember is that if you want to be 100% safe, a mask will not do it. Remember about the guidance of goggles? Well, if you have to wear goggles to be safer, that means the mask still leaves some holes in your armor. So you still want a social distance even if you're wearing a mask. A mask is more to protect other people if you're an asymptomatic carrier than to provide you with full protection from this virus.
Let me ask you this. If, like you and I, you wear glasses anyway, will that, in essence, give the same effect as goggles?
Well, it will help a little bit, but not as good because you still have the sides of the glasses. They're very much wide open, so a lot of things can enter through there. So not as good, but better. I mean, I've got very wide glasses, and that's what I use. I don't put on goggles. But if the virus gets much worse in this area, or if, I have to go to a very high-risk place, I probably would use goggles. I do have a set to use.
Now, you say you're being bombarded by internet trolls. What do you mean by that?
Well, this is really interesting. They're essentially fake accounts. When you go to them, the accounts are absolutely blank. And they'll leave paragraphs upon paragraphs of misinformation, quoting studies or political talking points. And then you go to the area where the troll's from, or you go to their account. They have no friends, no postings, mainly on YouTube. And it kind of mimics the Carnegie Mellon study that said 50% of the accounts that they've looked at on YouTube that relate to the coronavirus are coming from what they consider bots, or they look like bots, and they have the playbooks of foreign intelligence agencies. So it's really quite disturbing. I think a lot of the information that's confusing the public is purposefully put online, and it really does appear to be organized. I'm getting approximately 2 to 3 of these postings per day, which is really frustrating, and they're very aggressive and a lot of misinformation. I get a few on Facebook, and we get about 2 or 3 on YouTube. YouTube's very good at taking them off, though. If I flag them, they tend to be gone, and of course you can hide their posts, but you have to keep on top of it. But I think a lot of this is what's confusing the public. And as you know, Jack, I've been quite outspoken on many of the items on this epidemic. We've got a new article out in Infection Control Today on hydroxychloroquine and how laboratorily it can work in monkeys, but it doesn't work in humans. 2 different enzymes, and so the cell culture results have led us astray. And what's so depressing about this situation is is that there is a drug called nifamostat mesylate that does block the human enzyme. It is in clinical trials, but hardly any emphasis is given to it, not enough research, etc., because it's all going to hydroxychloroquine, where there's already been 4 randomized prospective clinical trials which have found it not to be effective. And it uses the monkey enzyme, not the human enzyme. That's the other analog drug. So it's really frustrating, and this is all being promoted by these trolls. So the United States is in a world of hurt. We really need to get going to try to get this misinformation counteracted on the internet.
Dr. K, always good to talk to you. We'll talk to you again on Friday.
All right. Thank you, Jack.